and she's held that position for almost 4 years now. Dr. Baldwin is originally from Minnesota, so she's like the only person in the room who's comfortable today outdoors. But I see the title of her talk is supposed to be the Colorado Department of Ag Update, but I suspect this will have to do more with animal health because she deals with all of the regulatory things, but also health outbreaks and preventing those, that sort of thing. So without further ado, I'm going to turn it over to Maggie, and she's brought some of her staff as well. So you've got some updates for us. Thanks very much.
All right, let's see. Yeah, if that's all right. Okay, all right, we're on. Can you guys hear me okay? Fantastic. Good morning. What an awesome turnout. I've come here the last, 4 or 5 years or so since I've been in this position, and I told Aaron about this last week. I said we can always count on snow. That got really loud. We can always count on snow the day before Marshall Fraser Beef Symposium is coming. So I knew that was going to happen. It was expected. We carpooled, thankfully, and the roads were not that bad. But really happy to be here again. Thanks for the invitation, Brittany, Mark. Todd, I see you in the back. And because Todd is such a good timekeeper for talks, Todd's going to keep me on time this morning. Okay, Todd? Yeah, all right. Okay, great. Now I'm going to start my timer instead. So as Mark said, I'm going to talk about some animal health updates. Todd is manning the booth back there. We've got some resources that he brought along from CDA. If you guys are interested in the veterinary shortage issues and crisis, there is the Cultivating Colorado magazine back there has a really nice feature on veterinary shortage. I'm not going to talk about that today, but I've got a number of other updates, and we'll see if the clicker works. So really going to focus on animal health things, but wanted to give a few high-level updates, and then I'm going to turn it over to Dr. McGrath. So just a reminder, who here has heard me speak before? Okay. Fantastic. Sorry, you get to hear it again. And it might be some repeating information, but hopefully some new information that builds on what we've talked about before, especially around avian influenza. But for those of you that don't know me, this is our mission for the Animal Health Division. And our job is to control animal health and disease activities in Colorado. I work for you, and so if you like or don't like what we're doing, come to me, let me know. If you're frustrated with rules and regulations, I'm the right person to talk to. You can talk to my staff and vent to my staff, but I'm the right person to call to if you want to yell at somebody. We work really closely with our livestock industry, of course, so thanks to CLA and CCA and our really good partners in coordinating with our livestock industry, our veterinary medical associations, CVMA, AVMA, and then other state and federal partners. I see a lot of them here in the room today, and really happy that we have all of these partners to protect the health, welfare, and marketability of Colorado's livestock. And so some of the things we talk about today that are around disease control activities are really important when we're talking about marketability of your livestock, not only here in Colorado, but nationally, and then, of course, globally. So a few updates. First, I'm going to introduce our brand new Assistant State Veterinarian, Dr. Erin McGrath. It is week 4 on the job, and I'm throwing her to the wolves today. She is going to be talking next about screwworm. So if you've ever wanted to hear about flesh-eating parasites, that's what she's going to be talking about, okay? And so be kind. Week 4, she's just starting, but she's going to give a great presentation here in a little bit. We do have a couple of veterinary vacancies. So our Western Slope field veterinarian, Dr. Pete Rolfe, he left because he is now the new state veterinarian in Nevada. So really excited for him, had a great opportunity for growth, and he walked into, we'll talk about in a little bit, a problem. I see, yes, a mess in Nevada. And then our Front Range field veterinarian, Dr. Ken Newens, is retiring at the end of June. So starting July, we'll need a new veterinarian. We're hoping to fill both of those quickly, but for Dr. Newens' position, try to fill that early and have a little bit of overlap for training for the new veterinarian coming on. So keep an eye out for those. If you know veterinarians, it would be great with our team in our office. Please send them to me. I'm going to talk about disease outbreaks, and mostly it's HPAI, HPAI, HPAI. So we'll talk about that today. Really quickly, animal disease traceability. Who heard about the new rule that went into effect November 5th? 2024, everybody should have heard about the new rule that went into effect. What is considered official identification? Radio frequency ID tag. So it has to be both visually and electronically readable. That's a new USDA requirement. We still have no-cost RFID tags available at my office, so please contact my team if you are interested in getting those. I know that there's a lot of producers in this room that already take advantage of that, so please contact us. Ag emergency management, I've got a slide on this, but there's also a brochure back there at our table on livestock preparedness for all hazards events, so take a look at that. We did hire on a new South area specialist. I'll show you his contact information, so get your phones ready if you want to take a picture of that here next. And then the next thing I'll talk about is our non-lethal mitigation program. Going to give very high-level updates about that. Oops, went too fast. So our Ag Emergency Coordinator, I think a lot of folks in this room have probably seen and met Dan Frazen. He is over our emergency management program overall. Our new specialist in the South area is Jerry Casebolt. He came to us. We've actually been working with him for a number of years on avian influenza response. He was the Logan County Emergency Manager, and now he's with us full-time. Very happy about that. They have built a really robust website. So if you guys are looking for information on emergency management, what resources are available to producers, what support can we offer producers for all hazards incidents, that website is really, really robust now and actually easy to navigate, which I know most government websites are not. So this one is actually really good and very useful. And hopefully, Brittany, we can get some of this and Jane, we can get some of this information in the next email newsletters from CLA that come out. High-level updates on, if the clicker will click, non-lethal conflict reduction program. So this is a new program to CDA. This is a program that came to us last year to really support our producers in managing conflict with all predators, but specifically wolves is the focus in the first couple of years. So we have 3 folks on that team. We are coordinating with all of our partners, primarily CPW on this, Wildlife Services, other folks from USDA. But we have Dustin Shiflett as our program manager. He's been with us since last summer. He actually worked with Conservation Services for a while, so he's a great resource. Shelby Nyberger, she was a brand inspector, so we stole her from Todd. Sorry, Todd. But she's a great asset to us, and she's now in the northwest corner of the state. Jesse Lassiter, he was one of the bison program managers down with one of the reservations in the southwest, and now he's our southwest non-lethal coordinator. We have a lot of information on all of these programs that are available on our website. I'll show that, I think, next. But those folks are out there doing site assessments for producers, trying to help support producers. What tools can we implement for non-lethal mitigation techniques to minimize that conflict with predators? Range riding and carcass management are 2 of those. This is a flyer that's available on our website. It's good, better, best practices for carcass management. There is no one-size-fits-all for carcass management, especially in the western slope in different rangeland areas. It's really challenging to do carcass management and do it well. So we have a good number of tools that are available. We've also worked on distributing $335,000 in grants. A lot of those went to local stock growers associations, looking at carcass management tools, trying to implement new non-lethal mitigation techniques. So a lot of money has gone out the door, and that'll be used up over the next 6 months, and hopefully we'll have some good lessons learned from that. We have some trainings that are going on across the state. The next one, and these are a whole bunch of different topics, all this is on the website. The next one, we got a little bit of shifting with the formatting, but I'll race you down to Buena Vista if you want to go. The next training is tomorrow afternoon from 3 to 7. I'll be there, the whole non-lethal conflict reduction program team. Also, we need to come up with a shorter name for that team. It's a mouthful, but that is in Buena Vista, so looking forward to that. If you want to take Dustin's contact information, that is also on the website. Any questions before I dive into avian influenza? Okay, so why am I talking about avian influenza to beef producers? Because every dairy cow has 2 careers. And I heard the first speaker had talked about this also briefly. The dairy cow's first career is making milk, and the dairy cow's second career is making beef. And it really is a very important part of the beef supply chain. And so what happens with avian influenza, especially in dairy cattle, is important. Now, I know Zach in the back. Zach told me that the last time I talked with the CLA producers, and I see some of them in the room, about avian influenza, I scared everybody. So I'll try not to scare everybody, Zach, this time, but I just try to be real. So I'm not going to sugarcoat the information because we've got a lot of things that are happening. And I'm going to keep this very high level. We have a lot of information on our website, but it is really important to know what's happening with this outbreak. This is one of the most novel disease outbreaks we've had in the cattle industry in a long time, certainly in the dairy industry, and one of the highest, most infectious, contagious diseases we've had that has challenged our dairy industry in a long time. We are familiar with tuberculosis, we are familiar with brucellosis, we are familiar with slower moving diseases. We have not been challenged with a highly contagious, highly infectious disease like this in the cattle industry, and it's really important for our beef producers because we have other diseases that we could be challenged with at any time. So sorry, Zach, I already lied and I already scared everyone. I see deer in the headlights looks. But it is really important that everybody be very aware of what's happening with this because this could change and this could happen and this could impact beef cattle at some point in time. Okay, so I'm going to start with good news. All right, I forgot I had good news first. Good news is that we have made a lot of progress since we had our first detection with avian influenza back in April of last year. We are the first state in the nation that has moved from affected status to unaffected status. That's great news. That is huge. That is a testament to the work that our producers have done in Colorado. That's a testament to the coordination that we've had with our producers. We have had no new cases in dairy herds since August, since our first round of bulk tank testing started. So that is a big accomplishment and something that I honestly did not see coming. We are decreasing our bulk tank testing to every other week. That started this week, so we're starting on an every other week basis. And as long as we continue to see negative results, we'll continue to decrease that. The other thing that I think we can be really proud of is that we have not let disease leave Colorado. We have not caused any other outbreaks in other states that we know of. Now, time will tell if we see other outbreaks, as more states get on board with testing across all of their dairy herds. But we have not seen any herds tied to a Colorado herd, meaning that we have not let the disease leave our state. So really quickly, this is one of the most challenging diseases that we've had, where we have the dairy industry and the poultry industry as our two affected industries. Now, oftentimes, as a regulatory veterinarian, we are balancing the needs of different industries and different commodities. Never did I think we would be balancing the needs of the dairy industry and the poultry industry. And this virus is impacting each of them differently. So it's not killing the dairy cattle at this point. So the dairy cattle on one side is, this virus could make me sick. Right? It causes them to lose milk production. We do see some low mortality with it, but really not a lot. We're seeing systemic illness. Some of our herds have had upwards of 30% of their cows affected, clinically sick. We had one herd of 1,000 head, and they had 300 plus head in their sick pens. They had to designate more sick pens because they had that many sick cows at one time. So it makes them sick, and we see pretty significant clinical disease, but they're not dying. Poultry, on the other hand, it wipes out almost 100% of poultry in flocks. The virus kills them. And then we have this other complicating factor about, what about me? People are also affected with avian influenza. And globally, H5N1 has a mortality rate in people of more than 50%. We're not seeing that right now. We had our first mortality associated with H5N1 in Louisiana, but we have not seen a lot of disease in people that is fatal. So that's great news, but we don't want to let this virus infect people. So I'm going to give a really quick virology lesson because this is important and why we care about this virus jumping to people. Okay, so if we start with DNA-based viruses. We have DNA-based viruses and RNA-based viruses. I promise this is really easy, so don't get scared, okay? It's really easy science. DNA-based viruses, when they infect a cell, they have what's called a proofreading mechanism. So as they replicate, that proofreading mechanism says, okay, great, you replicated the same, you're the same, and you can leave the cell and go infect another cell. Okay? So there's a proofreading mechanism that keeps them somewhat consistent. RNA-based viruses do not have a proofreading mechanism. So when they infect a cell and they replicate, they can change a little bit. And then they leave that cell and they go infect another cell, and they can change a little bit. So avian influenza is an RNA-based virus. So that wasn't scary, right? Makes sense? Avian influenza is an RNA-based virus. So as it infects more cells in different hosts, it changes a little bit over time. I hate to say it, COVID. COVID is also an RNA-based virus, and that's why we have so many different genotypes of that, right? So as we let this virus infect people, infect cattle, it will go into those mammalian cells and it'll say, I'd like to set up shop in this mammalian host. And it'll change, and that virus adapts, and then it becomes more infectious to mammals. And we don't want that to happen and become more infectious to people, because that's what causes things like global pandemics like the 1918 flu pandemic. That's what happens, okay? Zach, I really lied. I'm really not doing a good job of not scaring everybody. But these are important updates, okay? All right, so this is a very complicated graph, and it is changing. We're hopefully going to get this updated on our website, but this is to give you a very high-level overview of what happened and what we're dealing with right now. So avian influenza, good, this works, circulates in wild birds. This particular strain of avian influenza also is killing the wild birds. So H5N1 is spilling over. It spills over into wild mammals. It spills over into poultry flocks. By the way, I created this graphic, and I think it's super neat, but it's getting more and more complex as the outbreak goes on, so it might not work for very long. So it spills over into poultry flocks, and it kills them, right? Wipes out poultry flocks. And sometimes we have the virus moving from poultry flock to poultry flock. Then we had this very unique incident that happened with the B313 strain, where the virus spilled over from wild birds into a dairy herd. Okay? And then the virus set up shop in the dairy cattle because it's like, ooh, I really like the mammary tissue in dairy cattle. Who knew there were avian influenza receptors in mammary tissue in dairy cattle? None of us. We didn't know we needed to know that, but now we do. So then it moves from dairy cattle to dairy cattle. And this is a very complex transmission pathway that's not well understood, but it's moving from farm to farm. And it's also spilling over from dairy cattle to poultry flocks, and it's killing the poultry flocks. So we have this like sustained mammalian transmission of a virus that's normally only shed and carried by wild birds, and now is just wiping out almost all of our birds. It's wiped out double of our current inventory in Colorado over the last 3 years. We'll go over the numbers here momentarily. But then we've also seen spillover into people, both at dairy workers on dairy farms as well as workers on poultry farms. Does that make sense? Does that transmission pathway make sense? Okay, well, it's going to get harder in a moment. We have other spillover events that can happen. Pigs, that's one of the scariest of our species that this virus can infect, because pigs are like virus amplifiers. When a virus gets into a pig, they're like, ooh, I like this, I'm just going to shed a boatload of this into the environment. So that gets to be really complicated. So this very complicated transmission pathway looks like that. Okay, this is a representation of Colorado dairies, along with 2 of our poultry facilities, and all of the connections between those premises. So if you think about shared services, veterinarians, renderers, trash pickup, what are the different vehicles that come on and off your facility every day that are also going to a whole bunch of other facilities in that same day or that same week that could be carrying virus from one farm to another? There's a lot we have found. These are just shared service providers, connections. In Weld County, I live in Weld County, and I'm right next to a dairy. You can't go, a mile without finding another dairy or a feedlot that are going to have all kinds of shared connections. So we think about this with avian influenza. This is our biggest challenge we've had so far, is all of the different connections. Here's another representation of the same thing, maybe. Here. This isn't the same thing represented a different way. This is looking at the fingerprint of the virus. These two were direct connected. These two were closely related to this one in a cluster. I mean, we could not try to, there's not a smoking gun on how this virus is moving around. It's very complex. I'm gonna run out of time, Aaron. So this is hard. We haven't entirely understood it. But it's really important for us to think about if we were challenged with another highly infectious disease that might also impact beef cattle, might also impact swine, might also impact sheep and goats. Think about how complex these connections can be. And so every year when I've come and talked about things like biosecurity and things like disease preparedness, these are the things that quite literally keep me up at night. It shouldn't keep you up at night because, you know, we're working on it. But these are things that when we talk about what can we do today to be better prepared for another disease event tomorrow, that's what we're looking at. I'm looking at how do I protect all of Colorado's animals for the next thing to come. Because we've been in response mode now for 3 years with this H5N1 virus, and there is no end in sight right now. So I'm going to go through the very high level outbreak numbers very fast, and then I'm going to turn it over to Aaron. So, and this is numbers as of last week. In the United States, all 50 states have been affected with H5N1. We've had 15, this is poultry premises. We've had 1,500 poultry premises. We have lost more than 130 million birds since the start of this outbreak. That's why eggs are $10 a dozen. Because in Colorado, we've lost our entire egg layer population twice. So, oh, that's my timer. Okay, well, we're just going to ignore that and keep going. So in Colorado, we've had 37 prems affected. This is not the B313 strain. So I tried to separate it. What are the other strains just falling out of the sky from wild birds versus the B313? I tried to separate those two because the epi picture is different. So this is April 2022 to current, and we actually just had 3 new flocks this last week, so these numbers are not quite accurate. But up until B313 impacted us, we lost 6.3 million domestic poultry in the state of Colorado. We only have about 4.5 million total. So that's a big number. This is the dairy side. This is the USDA has dashboards on this, by the way. All this is available publicly. We've had 17 states affected, almost 1,000 premises. California is the most impacted state with dairies. Colorado is the second most impacted state with dairies. We have had 75% of our dairies in the state of Colorado impacted with avian influenza. So we've had 64 out of our 86 total dairies, all at this point are released from quarantine. With the B313 strain, we've had 3 commercial facilities last July. That was a bad month for us. We lost 3.3 million birds in the span of 3 weeks in Weld County. 2 backyard poultry prems. We've also, this virus is also really impacting cats and captive cats. We lost 2 tigers, a mountain lion, and an African lion at an animal sanctuary. We've had 10 human cases. So this is where we're at now, and there right now, like I said, we have not seen more cases of B313 in Colorado because we are doing surveillance. We are really doing a great job. Our producers are really doing a great job. But this virus, not B313 specifically, but other viruses are still circulating. I'm not going to go too much into this. I already highlighted that we're now unaffected. We're getting more states on board with surveillance. This is what our bulk tank tests look like. So green is good. We've got a lot of negative results. We're really happy that we are continuing to test negative. But here's the challenge. Why are we still testing? If we haven't had a case since August, why am I still asking our dairy producers to test? And by the way, we're coordinating most of the testing. But we don't know with this virus what immunity looks like. In a dairy herd, they're replacing 30% of their animals every year. So what does herd immunity look like when you're constantly bringing in replacement heifers, right? We don't know if these herds can be reinfected with the same strain or a new strain. So that's a big challenge. And we still have other strains of HPAI circulating. So as you all have seen in the last probably week and a half, there was a new strain affected with D1.1 in Nevada. So the dairies that were detected in Nevada have a new strain that is circulating in wild birds that had another spillover event into dairies. So we don't know what this looks like, but one thing we are pushing for, if I can get this to go, is vaccination, both in poultry and dairy. Vaccination is going to be one of the biggest tools, with no end in sight with the virus continuing to circulate in the wild bird population. Continuing to do national milk testing. Where is this virus nationally? If we don't have a good prevalence nationally and we don't have a good idea of what the spillover events are looking like, we can't really tackle this very well. And like I said, everybody really needs to be paying attention to what we're doing with HPAI, because this could be another new and emerging disease next year. It could be other diseases that we are looking at. So these are articles from the last couple weeks. We've got California, H5N1. Germany reported their first FMD outbreak in 40 years. Diseases are global. People are global. Animal products, feed products are global. And so what's the risk of disease introduction? African swine fever, also a global issue, and then screwworm. So screwworm is another one, and I'm going to invite Dr. Erin McGrath up to talk about screwworm. While she's coming up here, any questions for me? Did I scare everybody to pieces? Yes, ma'am. So they get sick, but they get over it, mostly. So what we're seeing is the cattle, they do get clinically sick. They have a decrease in rumination, decrease in feed consumption, they drop milk. Some of them don't come back into milk production. We still don't know what the full long-term impacts are. So we've seen a higher cull rate in those dairies that were affected. We also have seen a higher abortion rate in those dairies that are affected, and we don't know if that's due to the systemic disease. They do become, they get high fevers. Is it a febrile abortion? Not quite sure what that looks like. And then some mortality. Yeah. We don't know. We don't know. We don't think that they're continually shedding it because our herds are testing negative at this point. But I couldn't bank on that for sure. Any other questions for me before we talk about flesh-eating parasites? Yes, sir.
Do you have any evidence of that spillover to the beef sector?
Oh, gosh. Well, okay. I will say that a virus does not know the difference between a dairy cow and a beef cow. But what is the primary clinical sign? Decrease in milk production. How many of you are monitoring milk production on your cows? Probably none, yeah. So we don't think right now we're seeing an impact in our beef herds, but we are not broadly testing them. And that's all I'm going to say about that. Any other quick questions before I turn it over to Dr. McGrath? Okay, go easy on her. Erin, take it away.